Why does my belly look like I'm 5 months pregnant when I'm 67? That's what Margaret whispered to herself one morning as she stood in front of her bathroom mirror. She hadn't changed her diet. She hadn't gained weight. But her belly was swelling and each meal left her full after just a few bites. She thought maybe it was gas, or age, or just something she ate. But it wasn't. It was something far more serious. Something that would change her life: ovarian cancer. The silent killer. A disease that whispers before it screams. Every year, thousands of women brush off quiet, nagging symptoms thinking they're nothing. And too often, by the time they realize something is wrong, the cancer is already in an advanced stage. But it doesn't have to be that way. If you're a woman over 60, or you love one, this could be the most important message you hear today. Let's start with one of the most overlooked signs: getting full too quickly. Imagine sitting down to your favorite lunch, maybe a sandwich and soup, and feeling like you've had a full meal after just 3 bites. It's not because you're eating faster or less. It's because something inside may be pressing on your stomach. This is what doctors call early satiety. It's one of the earliest red flags for ovarian cancer. If you're losing your appetite or dropping weight without trying, and you know nothing else has changed, it's time to ask questions. Then there's the pain. That dull, nagging ache low in the abdomen that doesn't go away. For Margaret, it started as a quiet pressure, hardly noticeable at first. But soon it was there every time she bent over, stood too long, or sat in a certain position. Many women feel this and chalk it up to menopause or old age. But when tumors grow in the pelvis, they create inflammation that can press on nerves, tissue, and organs. The pain can radiate into the back or thighs, and it doesn't go away with rest or over-the-counter meds. It lingers, and it warns. Another sign that's far too easy to miss is bloating. Margaret noticed her waistband feeling tighter, her belly fuller. She assumed it was bread or maybe salt. But this wasn't ordinary bloating, it was persistent, uncomfortable, and new. Her stomach looked distended, almost like she was holding air. This kind of bloating doesn't come and go. It builds over days and weeks. Often it's caused by fluid buildup in the abdomen, a common effect of ovarian tumors. If your belly starts to feel firm, round, or swollen, and especially if it doesn't respond to diet changes, it's time to see your doctor. Fatigue is another quiet alarm. "I thought I was just getting old," Margaret said. "But I was tired before I even got out of bed." This kind of exhaustion is different. It's not just about sleep. Ovarian cancer drains your energy because your body is using its resources to fight something unseen. When even the simplest tasks like brushing your hair or doing laundry feel like a marathon, and you haven't changed your routine, that's a message you shouldn't ignore, especially when it's paired with other changes like loss of appetite or nausea. Speaking of changes, have you noticed a sudden need to urinate more often or more urgently? Margaret found herself waking up twice a night to use the restroom. During the day, she had to plan outings around bathroom access. When ovarian tumors grow, they can press on the bladder, making you feel like you have to go even if there's barely any urine. This symptom often gets confused with urinary tract infections, but if there's no infection and it keeps happening, it needs to be checked out. Digestive changes are common in women with ovarian cancer too. Constipation, gas, a feeling of being backed up, these can all occur when a tumor disrupts the normal rhythm of your gut. The ovaries sit close to the intestines, and pressure in that area can slow things down or cause pain when you try to go. Many women ignore it, blaming food dehydration or medication. But if constipation becomes frequent and your stomach feels unsettled more often than not, it's time to speak up. There are also symptoms that are harder to talk about, like pain during intimacy. Margaret hadn't told anyone, not even her doctor, that sex had become uncomfortable. She thought it was dryness or hormones. But the truth is, pain during intercourse can be caused by tumors putting pressure on internal tissues. It can also trigger pain in the hours that follow. This isn't something you need to suffer in silence. It's not a normal part of aging, and it's certainly not something to be embarrassed about. If your body reacts differently to intimacy, especially if it's painful, it may be trying to get your attention. Nausea, vomiting, or a sudden loss of appetite are other red flags. For Margaret, food started to feel like a chore. She'd take a few bites and feel queasy. At times, she had to force herself to eat. These symptoms happen when tumors impact the digestive tract. They can cause partial blockages or create inflammation that makes eating uncomfortable. And sometimes women just lose the desire to eat altogether. If that sounds like you, especially if you're also feeling tired, full, or bloated, it's worth investigating. Even your hair can give you clues. Margaret noticed coarse hairs on her chin that hadn't been there before. Later, she saw her hair thinning across her scalp. Hormonal imbalances caused by ovarian tumors can lead to hair changes, either sudden growth in unusual places or unexpected hair loss. Most women think it's aging or stress. But when these changes come on quickly or coincide with other symptoms, they're worth mentioning to your doctor. And finally, one of the clearest signs if you've already gone through menopause is unexpected bleeding. Margaret hadn't had a period in over 10 years, but one day she noticed light spotting on her undergarments. Even a single episode of bleeding after menopause is not normal. It may be something benign, but it can also point to cancer. Don't dismiss it. Don't delay. Get checked. Margaret's story could have ended differently if she hadn't listened to her body. Fortunately, she paid attention, got tested, and caught her cancer in time. Not every woman is so lucky. Ovarian cancer is one of the deadliest cancers for women, not because it's unstoppable, but because it's often undetected. That's why awareness is everything. If even one of these symptoms sounds familiar, don't wait. Talk to your doctor. Ask questions. Insist on answers. And if someone you love, a sister, a mother, a friend, is brushing off strange symptoms, share this message with her. It might be the nudge she needs. Now we want to hear from you. Have you or someone close to you ever ignored a symptom that turned out to be serious? What helped you decide to get help? Share your story in the comments. We're listening. You're not alone, and your voice might just help save another life.